How is RLS diagnosed with ADHD? If you or someone you know has been struggling with restless legs syndrome and attention deficit hyperactivity disorder, you might be curious about how these two conditions are diagnosed together. Understanding this process can help in managing both conditions effectively. Restless legs syndrome is identified through a detailed clinical evaluation. This is especially important for individuals with attention deficit hyperactivity disorder, as their symptoms can overlap. For instance, both conditions can lead to feelings of restlessness and sleep issues. Because of this, healthcare providers pay close attention to specific diagnostic criteria and symptom patterns. To diagnose restless legs syndrome, key features must be identified. First, there is an urge to move the legs, often paired with uncomfortable sensations. Second, symptoms tend to worsen during periods of rest or inactivity. Third, movement usually brings relief. Finally, symptoms are often more severe in the evening or at night. For children or individuals with attention deficit hyperactivity disorder who may struggle to describe their symptoms, healthcare providers encourage age-appropriate language. They might use terms like tickling or creepy-crawly to describe leg discomfort. This helps in accurately identifying the condition. Next, since children with attention deficit hyperactivity disorder may show restlessness that looks like restless leg syndrome, clinicians look for additional supportive criteria. This includes sleep disturbances that are appropriate for their age, a family history of restless leg syndrome, or evidence from sleep studies showing periodic limb movements during sleep. Polysomnography, which is an overnight sleep study, can document these limb movements. These movements are common in restless legs syndrome and can lead to sleep fragmentation and daytime fatigue. The diagnosis also involves ruling out other conditions that might cause similar symptoms. These could include growing pains, leg cramps, or other neurological disorders. A thorough medical history, physical examination, and sometimes blood tests help exclude these other causes. Since there is no specific laboratory test for restless leg syndrome, the diagnosis is primarily based on clinical evaluation. In the context of attention deficit hyperactivity disorder, it is important to understand that restless leg syndrome can worsen sleep problems and daytime symptoms like inattention, hyperactivity, and impulsivity. This is often due to disrupted sleep. Therefore, diagnosing restless leg syndrome in someone with attention deficit hyperactivity disorder requires a comprehensive approach. Healthcare providers often use structured interviews and questionnaires designed to detect restless leg syndrome symptoms in individuals with attention deficit hyperactivity disorder. They may also monitor sleep patterns and behaviors that suggest periodic limb movements. Treatment decisions will depend on confirming restless leg syndrome symptoms that are distinct from attention deficit hyperactivity disorder-related restlessness. By addressing both conditions, healthcare providers can improve sleep wellness and daytime functioning. Diagnosing restless leg syndrome in people with attention deficit hyperactivity disorder involves confirming core symptoms, using age-appropriate descriptions, and excluding other medical causes. Understanding how restless leg syndrome affects sleep and attention deficit hyperactivity disorder symptoms is essential for effective management.